So today we're going to be doing the ankle and I'll be palpating McKenna. So first we're going to start with the phalanges. So we have the distal phalanges. Number 1 is the big toe, 2, 3, 4, 5. Then we have the distal interphalangeal joint, which is the joint that's like closest to the tip of the foot. And so for the big toe, there's only the distal interphalangeal and then the proximal, whereas all the other 4 toes have the distal interphalangeal joint, middle interphalangeal joint, and then the proximal. So those have the 3 joints. Then we have the base of the fifth metacarpals or metatarsals, and these are at the bottom of all the toes. We have number 1, 2, 3, 4, 5. It's kind of near the ball of your foot. We have the calcaneus, which is your heel bone right here. It's this big bone at the bottom. Your Achilles tendon, which is kind of just behind your ankle right here. You can kind of feel where that inserts. Then we have the talus, which is at the base of the tibia. So it's this muscle or bone right here. Then we have the medial malleolus, which is on the inside, and the lateral malleolus, which is located at the base of the fibula. So then we're going to stand up and we're going to do muscle actions. So stand on one leg. This is your plantar fascia. It's not actually a muscle, but it's at the bottom of the foot. It helps stabilizes the medial longitudinal arch and propels the body forward during stance phase while walking. Then we have the gastrocnemius, which is your calf muscle right here. This originates at the base of the femur, so kind of past the knee joint. This helps in plantar flexion as well as knee flexion because it crosses that knee joint right here. Then we have the soleus, which does not cross the knee joint. It inserts here on the calf and then comes down or originates at the top of the calf and then inserts at the base of the calcaneus. And this helps in just plantar flexion because it does not cross the knee joint here. Then we have the tibialis posterior, which kind of originates around right here at the medial aspect of the knee and then comes around towards the lateral side of the foot here. This helps in plantar flexion as well as inversion of the foot. Then if we turn around, we have the tibialis anterior, which comes along this way, starts between the fibula and the tibia right here, and comes down and inserts along the medial side. Then we have the extensor digitorum longus. This muscle also starts around this area on the lateral side of the leg, and this one comes down this way and inserts along the 4 other phalanges. And then we have the extent, and this also helps in dorsiflexion, eversion, as well as extension of the 4 lesser toes at the metatarsal phalangeal, proximal, and distal interphalangeal joints. Then we have the extensor hallucis longus, which originates a little lower on the lateral side of the leg, and then comes around and inserts near the greater toe right here, and it helps function as a dorsiflexor, weak inversion, as well as extension of the great toe at the metatarsal phalangeal and interphalangeal joints. Then we have the peroneus brevis, longus, and tertius. So the peroneus longus starts at the highest point on the lateral side of the leg, and then comes around and inserts at the base of the 5th metatarsal bone. So the peroneus starts here. Then we have the brevis, which starts along in the middle side of the fibula, or kind of middle, and then it also inserts at the 5th metacarpal bone. Then we have the peroneus tertius, which starts kind of much lower on the fibula, and then also inserts at this 5th metacarpal bone. So all of those muscles help in eversion, plantar flexion, as well as the peroneus tertius also does not help with plantar flexion, but helps with dorsiflexion. So those are the muscles of the ankle.